If it doesn't apply to you and your program, you can just leave this blank. Next, identify who registered the car seat for recalls. Then you will be asked to identify any vehicle and car seat incompatibility issues. The information collected in this question is important for vehicle and car seat manufacturers to determine how well car seats fit in specific vehicles and seating positions. If the car seat was compatible with the vehicle with some difficulty, or if the seat needed to be replaced, the user is asked to identify what the incompatibility issue was with the car seat installation. You can select as many of the options in the drop-down menu as you'd like. Car seat and vehicle manufacturers can view the data collected about their products, which has the potential to impact design changes in both car seats and vehicles, which I think is a very exciting reason to use the Ndcf. You will also document if all corrections were made prior to departure. A documentation box is provided for the technician to report information that was not collected in the form or to expand on a specific situation. Personally identifying information should not be entered into the documentation box. In addition, there is a menu of discussion items that can be noted or checked based on conversation with the caregiver. The list is not all-encompassing, but does provide a guideline for topics to consider sharing with the caregiver. Step 5 is the caregiver sign-off. In this section, the caregiver acknowledges that they harnessed the child or the doll in the car seat and they installed the car seat. The caregiver can then enter their initials. If the car seat check was part of a virtual car seat check, the technician can enter the letters VR into the caregiver initial field. If the caregiver provided a donation, the amount of the donation can be entered into that text field. Remember, this is one standardized form intended to meet the needs of many. It does not mean that you are expected to collect donations if that is not a part of your program. Next, document whether the caregiver was provided educational materials. And if a final inspection sign-off is required, the technician instructor or proxy can enter their name into the final inspection sign-off field. If a final inspection is not required, this field may be left blank. The agency documentation box is available for technicians to document specific agency-related information not already collected on the check form. The form can be saved as a draft at any point throughout the car seat check process. Once the form has been completed, it can be submitted. Select the Submit button to upload the car seat check information into your account. If there are any required questions that were left unanswered, the form cannot be submitted. All required fields must be answered. All unanswered questions will be highlighted in red for easier identification. Once all the questions have been answered, the form can be submitted. Once this is done, you will receive a message indicating that your form submission has been saved. This feature supports consistency in information collected and helps avoid the submission of incomplete forms. Again, additional children can be added to the form, and there is no limit to the number of children that can be added for a particular caregiver. Select the Add Child button to begin collecting new car seat check information for additional children. Follow the same steps to collect car seat check information for each additional child. With the Ndcf, technicians have immediate access to all data that is entered into their account. Any car seat check that their name is associated with will also be included in their user report. Approved program managers can track technician activity, seat distribution, misuse rates, and event reporting. The user report also provides agencies with an opportunity to gather and share data required for program funding. Our next speaker, Adele Polson, will share more detailed information about the data retrieval process as well as Ndcf data dashboards. The Ndcf includes a tiered access system, allowing injury prevention programs to also have immediate access to data collected using the Ndcf. Again, all information collected is stored and saved on a secure server. As shown here, use of the Ndcf by CPS technicians is at the foundation of this resource. Currently certified CPSTs who have created accounts have access to their car seat check data. Program managers, once approved, also have immediate access to real-time data collected through the Ndcf, which allows for easy and efficient data sharing. Programs can submit an admin account request to begin reviewing and analyzing the car seat check data affiliated with their agency. State, territory, and regional CPS program coordinators, such as those with Indian Health Services and Ndcf, have access to data collected in their respective areas. And vehicle and car seat manufacturers can view information pertaining to their products, again, providing the potential to influence product engineering and design, which can naturally lead to reducing field misuse and increasing car seat and vehicle compatibility, both of which are known to reduce injuries and prevent deaths. As you can see here, the National Child Passenger Safety Board has a webpage dedicated to the National Digital Car Seat Check Form. On cpsboard.org, you will find tutorial videos, how-to guides, FAQs, and additional information about the use and application of the Ndcf in the field, including guidance for using the Ndcf with child passenger safety technician certification courses. You're encouraged to visit the CPS Board website for more information about the Ndcf. The direct web address is cpsboard.org/Ndcf, as shown at the bottom of our slides. Speaking of, the updated 2020 National Child Passenger Safety Technician Certification Training does reference use of the Ndcf. One update here that I would like to mention is that the example check form found at the back of the technician guide, check form version 4.7, is now outdated. So please be sure to download the most current check form from either carseatcheckform.org or cpsboard.org/Ndcf. For the Ndcf, you should now be using check form version 5.1, and this should not change again before October 1st later this year. As I mentioned earlier, the Ndcf resource has been developed by technicians for technicians and is continuing to evolve based on feedback from the field. All feedback is collected and discussed by the Ndcf program team, and we want to hear from you. Users can provide feedback by selecting the Report Feedback tab when you're logged into the Ndcf. You enter your feedback directly into the Report Feedback page, and it will be sent to and tracked by the Ndcf program team. Here's contact information for the Ndcf program. If you have questions about your account, need assistance viewing your data, or setting up a primary point of contact for your program, please email info@carseatcheckform.org. For field training support, virtual seat check sign-offs, or to schedule an orientation training, please email training@carseatcheckform.org. You're also welcome to email me at amy.artuso@nsc.org. And again, information and resources can be found in the resources section of carseatcheckform.org and on the cpsboard.org website. With that, I'd like to thank you for your time and attention. And now I turn it over to another member of the Ndcf program team who will talk with you more about the Ndcf data, Adele Polson from Westat. Adele?
Thank you very much, Amy, and thank you to all of you listening for the opportunity to get to speak to you today. I'm going to focus my presentation on the data, who's using it, what's available, and how it can help you and your programs. Next slide. Thank you. Amy has touched on all of this, but just to reiterate, I'd like to go over why the Ndcf data is so important. We know that data is critical to developing evidence-based solutions for improving CPS programs and, of course, for saving more lives. For technicians, you will be able to track the number of car seat checks you are conducting, and you can start to understand the misuse you are seeing with the caregivers that you are working with. The Ndcf also eases reporting burdens as information from car seat checks are entered and compiled as soon as you submit a digital check form. For agencies and states, you'll be able to evaluate the same kinds of things, but at the state or agency level. You'll be able to easily extract how many checks are conducted, where, and also the trends and patterns that are occurring in your area. Additionally, we hope that you can use this data to help justify programs, positions, and figure out which caregivers are attending and which are missing, so you can advertise to those geographic and demographic groups. I'd like to explain a little bit about what WESTAT does to process and analyze the data. While all raw data is maintained and available in the Ndcf, data is also professionally cleaned, analyzed by our specially trained statisticians, and presented in data dashboards. As with any data set, before data analysis occurs, we take several steps to clean the data. These steps create a data file that's ready for analysis in statistical software packages. We always maintain a raw version of the data that is always accessible to you, the users. The data never goes away, and users always have access to that raw data as long as they maintain their registration with the Ndcf. Through data cleaning and preparation, we create an additional clean data file, and this process simply enhances the data. So just to be clear, data cleaning does not involve removing or diminishing the data. Throughout the data cleaning process, we are very cautious about not unnecessarily altering any of the data. Before we change anything, we look at multiple sources. We look at things such as the documentation box, the open text fields, and the response patterns, and use it to verify that the record actually did need to be edited. This means that we always err on the side of trusting the technician and what they originally entered. An example of the data cleaning would be recoding the vehicle make variable. These are some examples from the year one, and you can see that there are several cases of misspelling as well as entering incorrect information, which in this case, people were accidentally entering the vehicle model instead of the make. In other words, if we wanted to filter and find the data for all of the Chevy vehicles, this recoding would be essential to getting an accurate list of all the car seat checks conducted in Chevrolet vehicles. Once we have this clean data, we undertake analysis. The analysis covers 4 main topic areas. That's program effectiveness, educational messaging, car seat design, and vehicle design. In January, we released updated data and data dashboards. This release provides all of the Ndcf data through September 2020. In total, over 32,000 car seat checks were conducted, which is extremely impressive. Many of the same trends that we saw in the year 1 data have continued into the year 2 data. Most of the checks are done on infants who are under 1 year old or on unborn children, and the most common type of car seat is the rear-facing only seat. We also carefully looked at misuse. The misuse rates from year 1 to year 2 remain largely the same. This slide depicts the percent misuse in 3 categories and also the top 3 types of misuse within those categories. One of the great features of the Ndcf form is the level of detail that is collected about each car seat check. So we can see that overall harnesses were misused in about 38% of the applicable car seats. But we can also dig a little bit deeper on that and identify the top 3 types of harness misuse. And that was that the harness was too loose, followed by the chest clip at the wrong height, and the harness routed through the wrong slot. We also looked at seatbelt installation. When that was used, the misuse rate was nearly 60%. And again, we list the top 3 seatbelt misuses we saw. And then the lower anchor misuse rate was 43%. Once the analysis is done, it's fed into data dashboards, and these dashboards consolidate all of the results and feed them into various charts, graphs, and maps. This display of the data, as opposed to just providing standard tables filled with tons of numbers, consolidates multiple findings into a few summary outputs. The dashboards are built to display key findings in a more user-friendly format with the idea of making the data more useful to all users. And they also aim to make trends easier to identify and the overall snapshot easier to understand. The year 1 and year 2 data dashboards are now available on the Ndcf website. All users have access to a national level dashboard with all of the checks from July 2018 through September 2020. If you've personally conducted seat checks, you will also have access to a dashboard with just the car seat checks that you conducted. So let's take a closer look at these dashboards. First, how do you access the dashboards? There are 2 locations where you can access the dashboards. Although, I just want to note this, although the dashboard will open on a browser on your phone, we highly recommend that you access the dashboard from a desktop or laptop PC. As you'll see, the dashboards contain a ton of information and graphics, so a larger screen is always best. Agency or state coordinators can click on the Agency Admin tab on the NDCF webpage and then View Dashboard to view your agency dashboard. All users can also access the national dashboard from this agency admin dropdown. To view seat checks you have conducted and submitted, you would click on My Account and then View Dashboard. And you can also see the national dashboard here as well. Please remember, the dashboards only display data collected between July 2018 and September 2020. If you or your area don't have any checks for that time period, you're going to see the screen above, which says no dashboards found. But don't worry, we are planning to begin releasing updates every month starting in March. They will include data collected from October through the end of January. So now is the ideal time to work with our NDCF program team to set up your accounts and start collecting data. Once we open the dashboard, the first detail you'll notice is this large orange box at the top of the page. This box contains the caveats and details on the data presented throughout the dashboard. Our goal is to be as transparent as possible about the representativeness of the data, as well as how all of our calculations were made. To maximize the viewing real estate on each page, users can hit X in the upper right-hand corner to close this box. Now here is the home page. As you can see, it provides overall counts. We've got a total number of seats, the percent of misuse overall, number of different technicians submitting forms, number of states where checks were performed, and also our number of international checks performed. This chart also shows the number of seats by month and by seat type. So by graphing the monthly seat checks, we can see that overall, we checked more and more seats each year in the first year of the NDCF program. We can also see the dip in April and May of 2020 when the pandemic resulted in most of the country being shut down. Now we're going to zoom in on a closer look at the main menu. From here, you can access pages on misuse, maps depicting all of the seat checks by zip code, car seat information, vehicle information. You can also access our brand new table tool, which I'll give you more detail on shortly. Throughout the dashboard, if you would like additional information about any of the data in a chart, you simply hover the mouse over the chart and additional details will pop up. So in this case, you can see that 645 rear-facing only seats were checked in July of 2019. Now we're going to start looking at the individual pages. Here is part of the car seat misuse page. This page depicts misuse by the state. On this map, you can select different types of misuse. This map is currently depicting any misuse among all types of car seat checks. However, you can click on different categories on the left-hand side, and you can toggle between either all checks, postnatal checks, and prenatal checks. Then across the top, you can select misuse rates across different misuse categories to include harness misuse, load leg misuse, lower anchor misuse, and so on. And here's another example of the tooltip I mentioned. Here I've clicked on harness misuse, then I clicked on the Illinois square because I knew I was going to be talking to all of you today. You can see the tooltip gives us the harness misuse rate in the state of Illinois. To provide context to this misuse rate, we also report the total number of checks and the number of checks used for this analysis. Finally, we provide the top 3 misuse subcategories in Illinois, and that is that the harnesses were too loose, the harness clip was at the incorrect height, or the harness was twisted. On this page, you can also see misuse by child restraint type and child age. Now I'm moving on to the car seat information page. On this page, you can see the number of car seat checks by location in the vehicle and type of car seat. And here is more of the car seat information page. You can see the number of car seat checks by installation method. So how did the car seats arrive? How are they installed? And finally, the number of car seat checks by the year the car seat was manufactured and whether the car seat was expired. Looking at this chart, we can quickly conclude that very few car seats were expired, with most of them being manufactured in 2019. Here's part of the vehicle information page. This provides summary of the types of vehicles seen at car seat checks. This chart displays all of the makes and models. As you can see, there's a good distribution of different makes and models of vehicles at car seat checks. Unfortunately, the text is a little tough to read in this PowerPoint, so I've zoomed in on some of the more frequently seen makes and models. The vehicle information page also provides the types of vehicles seen at checks by showing us the distribution of vehicle makes. And finally, we have a chart with the number of checks by vehicle year. In the year one data, we noted that many newer vehicles were seen at seat checks. Adding in our year two data, we're still seeing that same trend. As we developed the dashboard, we considered other goals for effectively using the data. Our ultimate goal is to give you all a tool that helps you and your programs and helps keep children safe. So over the past year, we've met and presented to all types of different users, from technicians working across the US in different settings, to car seat manufacturers, to automakers, and we've solicited their feedback and worked to meet their needs. We received many requests for help in directly and simply providing all of the data needed for reporting. To give context to what I mean by this, let's quickly review an example of a typical program reporting form. Tracy Whitman from Maryland KISS was nice enough to allow us to use her reporting forms as examples of the type of data many programs need. So this is a tally sheet that her and her team completes for each car seat check event. When working with paper forms, a member of her staff would flip through the forms and manually tally the results. Then they take these tallies and summarize them, perform some additional calculations on this reporting form, right? So you can see where this could take a considerable amount of time after each car seat check to make sure they have all of this information correct and to tabulate all of these car seat checks. So our goal is to eliminate the need for this manual counting and calculating, and instead provide these counts via the dashboard. So we accomplish that by creating a table tool. And this table tool allows users to select variables they would like to examine, as well as apply filtering. We were going to try to show you a quick video, but that didn't seem to be working. So we're going to move on to the next slide. I'm going to try to quickly show you how the table tool works. We're looking, in this example, we're going to be looking at data from several states, but you can create the exact same counts with your data. So here is, when you click on table tool, this is what you see. On the left-hand side here, we have all of the different variables or pieces of information you can look at. So if I look over in that top right-hand corner, I can see that for this area, we have 246 total checks. And we see all the variables that we can look at. And then we can add them as rows to our table by clicking and dragging them into the center box. Let's see. Or we can make them columns by clicking and dragging them to the top box. So let's take a look at the number of seat checks by state for NHTSA Region 10, right? We just pulled the event state into the column, and here you can see the breakdown. So let's say we'd like to see the event state and breakdown by ages of children. I just took the child variable, dragged it over to that column section, and now we can see all of the different ages of the children in the states. Now let's see. Imagine that we want to see the types of car seat checks that are being conducted virtually. All right, we're totally switching gears here, pulled out these different variables, and now we can see what kind of virtual car seat checks that we have been doing. If we wanted to do some filtering, we click on that drop down arrow and we say, we just want to know only for virtual checks. So where virtual check equals true, what does it look like? We hit apply. And here we go. So here are these are the types of seat checks that we are doing virtual checks on. So it looks like for Region 10 of NHTSA, we've only done rear-facing convertible checks. But what you can see is that this tool really allows you to dig into the data any way you want. If you have access to the dashboards, if you guys have been using the Ndcf, I strongly encourage you to go into this dashboard table tool and just play around. You can't break anything. That's the really great feature of this table tool. And you can pull in the different variables. You can try playing with the filter because there's really many different ways to filter and examine the data. Getting the data into the hands of the CPS advocates is critical to us. So in addition to the data visualizations and the table tool we've provided, we also give you two different data files. As we've mentioned, there is the raw data file from the Ndcf that is available in real time, meaning as soon as an individual technician submits a check form, that raw data file updates and is available to you. And now you can also download the clean data through September 2020. And we accompany this file with a data dictionary, which basically explains what each of the variables mean. So to access the raw data, this is the one always available. As Amy mentioned, you would go to user report, and then you would say get user report. To access the processed and clean data from your dashboard, on the dashboard homepage, in the lower left corner, you'd click on Filtered Data File. So to quickly summarize our timeline, we released the year one data on October 1st. At the beginning of January, we released our year two data. So you can now access the clean data and dashboards for all of the data collected through September 2020. Starting in March, we're going to provide monthly updates to the data. So on March 1st, you'll be able to see the dashboards for data through January 21. April 1st, you'll be able to see the February data. So we do need about a month to process the data and get it clean and put into the dashboards. As Amy mentioned, constant improvement and evolution are essential to the philosophy of our program. We view the Ndcf, including all of the apps, resource materials, the data processing, and the data visualization as continually improving. It starts with collecting data. We want you out there using the Ndcf at seat checks and telling us what works and what could be better. And then you can also work with the data and tell us what works and what could be better. Then the Ndcf team reviews every single suggestion and develops an effective solution to address it. Then we implement those suggestions and we can continue collecting more data, testing out our improvements, and gathering more feedback. We will continue to solicit, gather, and review suggestions. Every suggestion is captured in a special issue tracking tool. If you go to the Ndcf webpage, you click on report feedback, you are directly communicating your idea and suggestion to the Ndcf team. So you are all invited and encouraged to add to our list of feedback. Each recommendation is captured, reviewed, approved, implemented, and tested before being deployed. The entire Ndcf team is very happy with the excellent start to our program. Looking at the current data, we have a robust data set with good representation of different makes, models, and children of different ages, and it's just going to keep getting better and better as more and more techs use the data and the program continues to grow. There are almost endless possibilities to the different types of analysis that can be conducted. The Ndcf dataset is very rich with 93 different pieces of information about each seat check. So the Ndcf team plans to continue to work closely with all the stakeholders, including all of you, to get you the data you need for your programs. Myself and the entire program team look forward to working with you. Please feel free to reach out to any of us. And thank you very much for your time today.
We have a few questions. Do you have vehicle types as variables similar to to type of car seat, like sedan, SUV, minivan, pickup truck?
We are
So how
planning to roll
detailed
that
is it?
out. Yeah, we are planning to roll that out in March. Right now, we have the actual make and model, but in March, we are going to be rolling out vehicle types.
Okay. Are separate logins required for technicians associated with multiple agencies?
Ooh, Amy?
No, I don't believe so. I believe it's a drop-down menu and you pick the agency that you're working with that day.
Do you inform registered users about updates of the software or PDF file versions?
Yes. Yes. And I don't know if I'm supposed to say this or not. There's going to be a curriculum update coming out soon from the National Child Passenger Safety Board. And so it'll be communicated. The one that I referenced will be communicated with that as well.
It was talked about yesterday, so you're okay.
Okay, perfect. Thank you, Claire. So from like, I'm just going to take the hit for it later if I wasn't supposed to say that.
It was touched on. Okay, I see that the height is a required box. Frequently, the child is not present and a parent does not know. Can we put the U for unknown?
I'm sorry, say that again. I'm trying to see.
So the
chat
height,
box.
there's a height required box. If the caregiver doesn't know what it is, can we just put a U for unknown?
I guess in my practice as a technician and instructor, I usually have something there to measure the child. So that would be our first recommendation. But it does come down to, we don't want people putting in inaccurate information. So that's something we can go back and look at and see if I want to make sure that the electronic form would accept that because it's a letter versus a number.
And of course, we all know height and weight are critical to ensuring that the correct seat is selected. And that is something that we do want to start looking at, are children riding in appropriate seats for their height and weight. So, you know, even if the child's not there, we really hope that parents can give us a close estimate of the height, which is why we're really trying to push to get that information, because in talking with different experts, including the National Child Passenger Safety Board, how do you know that you're putting the child in the correct seat if you're missing that information? But we also know nothing's perfect, right? So we do the best we can.
And that seems to be a concern for several of the technicians because it's asked in a couple different ways. Some people are asking about grandparents that come in and they're not knowing, and the kids may not be there. So like what is the results for that?
And I do see that someone asked what if mom is pregnant, then you're not expected to enter a height and weight for an unborn child.
Okay, so you saw that one too. Okay. Will these slides be available after the presentation?
We can definitely make a PDF available.
Okay, then I have another one text to me, so let me get to it. You spoke about the dashboards. Can an agency customize a dashboard for what they want the information to be generated?
That is where we've provided the table tool. Everyone receives the kind of set of graphs and visuals that I showed you and kind of ran through quickly. But in the table tool, that is where each agency can filter and cut their data as they'd like. We, as I said, constantly accept feedback. So if there is something that as an agency you absolutely need and can't get from the table tool, or would like some one-on-one assistance with the table tool, we are happy to provide that.
Okay. What about passwords? How about how to reset your password? Some technicians are having problems with their password and can't get it reset.
You should, so make sure you're using carseatcheckform.org for starters, because we do know there's a lot of confusion in the field between the Ndcf website, the CPS board website, the certification website. So number one is make sure you're using the right user name and login for the website you're on. Second, for this one, for the Ndcf, email info@carseatcheckform.org. We say, like when you're getting a new account approved, allow 3 to 5 business days. Often it happens much faster. we just really have that disclaimer there because we want people to know if you're at a car seat check on a Saturday morning and you fill in the information to create a new account, likely it is not going to get approved on the spot. But email info@carseatcheckform.org, and they usually are very responsive.
And then we have a couple more questions about Wi-Fi in the self-service. Can it be used offline, which I think you touched a little bit on?
Yeah, so you want to make sure first that you're creating an account when you're connected to the internet on a web-based platform. Then you can go to the App Store. Once your account is approved, go to an App Store for the type of app that you need, Apple, Android, Amazon. You'll download it. I went over the criteria for what you're looking for. It's the same icon for all of them, same name, same developer. You have to be connected to the internet when you first download it and like get it established. But once you're out in the field, you can just put it on airplane mode and you can still use it. You can conduct an unlimited number of car seat checks. And then once you're back in range of the internet, you'll be able to submit all of that information and it will upload.
Okay, that's all the questions we have for now. With that, thank you very much for the presentation. It was very, very useful.
Thank you for having us.
Thank you, Amy, and thank you, Adele. That was great. We have to end our time for the third session, or for this session today. Thank you for the interesting session. For the participants, please see your participant packet to join the next session, which would be the last session of the conference. So close your browser and then open a new window with a new link. And then both of the upcoming sessions are worth a CEU. So there you go. Thank you again, Amy and Adele.
Thank you very much.
Bye.
Bye.
Bye.